Assessing the anus and rectum.
Good day, ma'am. I am going to perform assessing the anus and rectum. It is the process of examining the client's anus and rectum that includes inspection. The purpose of this is to determine abnormalities in client's anus and rectum. The equipment only clean gloves. Considerations before, during, and after the procedure. Identify client and explain procedure. Provide privacy. Make sure client is comfortable throughout the process. And document findings. Things to document after the procedure. Observations, findings either normal or abnormal. Okay, the first action is introduce self and verify the client's identity, explain the procedure to the client, and provide privacy. Good day, sir. My name is Rahma, Naim. Today, I'm going to assess your anus and rectum. Is it okay po na i-assess ko yung anus? This is to gain cooperation and lessen the anxiety of the client. Second is ask the client to empty her bladder before the examination begins. Sir, nakainom na po ba kayo? This is to provide clients comfort. Next is perform hand hygiene, apply gloves, and observe appropriate infection control. This is to minimize contamination. Okay, so let's start. Position the client in adults, a left lateral or six position with the upper leg acutely flexed in required for the examination. A dorsal recumbent position with hips externally rotated and knees flexed or a lithotomy position may be used. For males, a standing position while the client bends over the examining table may also be used. This is to provide good visualization of the anus and rectum. Okay, so inspect the anus and its surrounding tissue for color, skin integrity, and presence of lesions. Then, ask the client to bear down as though defecating. Bearing down creates a slight pressure on the skin that may accentuate rectal fissures, rectal prolapse, polyps, or internal hemorrhoids. Describe the location of all abnormal findings in terms of a clock with the 12 o'clock position toward the pubic symphysis. Normal findings: intact and perennial skin, usually slightly more pigmented than the skin of the buttocks. Anal skin is normally more pigmented, coarser, and moister than pre-anal skin and is usually hairless. And for the abnormal findings, presence of fissures, cracks, ulcers, excoriation, inflammations, abscesses, protruding hemorrhoids, which is dilated veins seen as reddened protrusions of the skin, lumps or tumors, fistula, openings or rectal prolapse, varying degrees of protrusion of the rectal mucous membrane through the anus. Okay, remove and discard gloves. Perform hand hygiene. This is to prevent spread of microorganisms. And lastly, document findings in the client record using printed or electronic forms or checklists supplemented by narrative notes when appropriate. This is for record of data.